Hi, I'm Patrick Gauthier, Director of AHP's Healthcare Solutions. And, the history, the how and why AHP became involved in the drug Medi-Cal ODS waiver really harkens back to the waiver itself, that the waiver has requirements and demands of counties and providers that exert, I think, a kind of pressure that not all counties and providers are prepared to meet. And an existing relationship between AHP and LA County, what is it that we can do to add some expertise and some experience in the areas that I think are especially challenging to counties and providers as it relates to the waiver. The financial infrastructure and the rate setting were the primary objectives of our work. Waiver, by its very nature, by its very name, an organized delivery system, is asking that providers begin to see themselves as a system of care. And I believe that en route to an integrated system of care, integrated with mental health and primary care, that substance use disorders treatment providers need to begin to see themselves as a network of care themselves. And it's easy to see that conceptually on paper, that there's a continuum of care in my region or my county, but it's another to conceive of ourselves as a network of care that has formal relationships between providers who have agreements between them, and that network constitute a joint venture, if you will. And I think that's the path forward for providers, and that path forward needs to be embarked on as soon as possible. So this idea of an organized delivery system, to begin to manifest that system, that network with the agreements in place today among substance use disorder treatment providers, if you will, a substance use disorders treatment network that is harmonized, that is brought together, sharing perhaps health information technology, sharing some back office administrative capabilities, whether it's billing or quality assurance, the collection of outcome measures and so forth, recruitment and retention of licensed staff. Those are the kinds of things that, if we look forward 2-3 years down the road, these organized delivery systems are going to be very taxing on providers, and to start now in joint venture type relationships with our colleagues is a very important lesson to learn today, and not 2-3 years down the road when it might be too late.